Hi, we're Operation Heart from the University of the Pacific, and we would like to educate you on the causes, risks, and preventative measures for high cholesterol and high blood pressure.
What is hypertension? Hypertension is high blood pressure, which depends on the force of blood pushing against the walls of the artery. According to the American Heart Association guidelines in 2017, hypertension is an average daytime blood pressure higher than 130 over 80 millimeters of mercury. Normal levels are less than 120 over 80.
Over 100 million adults in the US have hypertension, and about half of patients with hypertension don't have sufficient blood pressure control. Hypertension is one of the biggest reasons people make visits to their doctor's office. Most of the time, high blood pressure doesn't have any obvious symptoms to indicate that something is wrong, but the effects are very real. The best ways to protect yourself are being aware of the risks and making changes that matter.
Older age, family history, and certain races are factors that may increase your risk for hypertension. In addition, lifestyle changes such as losing weight, decreasing alcohol consumption, and not smoking can help decrease your blood pressure. Please speak to your primary care provider on more ways to help.
There are two ways to measure your blood pressure. At a doctor's office, you may be familiar with a blood pressure cuff. However, when you're at home, you may find using an electronic wrist blood pressure monitor more convenient. For more accurate results, remember to rest 5 minutes before taking a test. When sitting, keep your feet flat on the ground, back fully supported, and legs uncrossed. Do not talk while you take your test. It is also good practice to take your test on an empty bladder. The next time you visit your doctor, remember to ask them about a blood pressure test. Normal blood pressure levels are less than 120 over 80 millimeters of mercury.
The American Heart Association website at www.heart.org contains many resources regarding blood pressure. It includes this chart right here with all the different blood pressure values, as well as an interactive module where you can choose what kind of blood pressure range you fall into and determine what next steps you can take.
Cholesterol is a waxy, fat-like substance found in the blood. It comes from two sources, the liver and foods derived from animals such as meat. Unhealthy cholesterol levels are caused by lifestyle habits such as unhealthy eating patterns and genes inherited from parents. High levels of LDL or bad cholesterol can cause plaque to build up in your blood vessels, which can lead to heart attack, stroke, and other health problems.
How can cholesterol be measured, and what are normal levels? It can be measured with a blood test called a lipid panel. A health professional can take a blood sample from veins in the arm, preferably in the morning. This test is generally more accurate when the patient has fasted for at least 9 to 12 hours prior to the test, but it's not always possible as it can be inconvenient for the patient. So what are the normal levels of cholesterol? It's going to be total cholesterol less than 200 milligrams per deciliter, non-HDL less than 160 milligrams per deciliter, LDL less than 130 milligrams per deciliter, triglycerides less than 150 milligrams per deciliter, and HDL, more than 60 milligrams per deciliter.
To prevent high cholesterol, you need to have a balanced, heart-healthy diet and lifestyle. You should avoid foods with high saturated and trans fats and increase your intake of fruits and vegetables. Making lifestyle changes like quitting smoking, reducing alcohol intake, and getting moderate daily exercise are great ways to improve your levels of HDL good cholesterol and reduce your risk of acquiring serious diseases and conditions.
Engaging in at least 150 minutes of moderate intensity exercise per week will help lower your blood pressure. This is about 30 minutes of activity per day, 5 or more days a week. Some examples of activities that could be done include jogging or walking, riding a bike, or playing sports.